regarding deep endometriosis. The grading is similar as the peritoneum, ovary, and tubes previously. So it only has 1, 2, and 3, and the measurement of the lesion is similar. 1 is less than 1 centimeter, 2 is 1 to 3 centimeter, and 3 is more than 3 centimeters. This is applicable for all these 3 compartments. The previous organs, peritoneum, ovary, and tubes, the measurement is like slightly different. So for compartment A, for compartment A, it runs in the craniocaudal direction and assesses the posterior vaginal fornix and involvement of the rectovaginal space. So this lesion is measured in the sagittal or midline section, and if there are evidence of more than one lesion, the total lesion is accumulated and further graded into the scoring. Okay. So by TVS, it also can be done. So this classification is, if via TVS, is according to the International Deep Endometriosis Analysis Group idea. So the maximal diameter of the lesion is measured in mid-sagittal section craniocaudally. For compartment B, it involves the uterosacral ligament, cardinal ligaments, and pelvic side wall. So this is actually the medial lateral axis, which also slightly extends dorsolaterally. However, this axis, medial lateral axis, sometimes can cause intrinsic or extrinsic involvement of the ureters with hydroureteric changes or hydronephrosis. But this part is regarded as compartment F and U, involvement of further organ, which is the urethra. So this is not involved, not included in this compartment B actually. They also annotated that this, according to the previous ENZIAN classification, there is B3 that they regard as ureter involvement with or without hydronephrosis. But the revised ENZIAN classification, they only mention regarding the lesions, size of the lesion. So as this is also a paired organ, so it has a left compartment as well as left and right side. So via TBS, to assess the compartment B, or mediolateral compartment, the probe is inserted to the posterior vaginal fornix and the cervix is visualized. This is defined as mid-sagittal plane when we are able to see the cervical canal. And then it is visualization of the uterosacral ligament is achieved by horizontal movement of the TBS probe by 20 degrees. This is an anatomical insertion of the uterosacral ligament laterally. And then the probe may rotate necessarily to visualize along the uterosacral ligament and to visualize any lesions along the ligament. So if any deep endometriosis lesion within this visualization should be measured in its most lateral extension. So in the middle here is actually the compartment A and C. The ones that is being assessed is compartment B, which is the lateral part. Here is uterosacral ligament and cardinal ligament. So any lesions along over here is measured by TVS, and the largest or cumulative lesion is referred to during the grading system. Okay, this is an example they provided. This is a TBS of to assess the compartment B. So you can see here is the encoding of the findings. Hashtag ENZIAN. B is compartment B. 0 is, here is the left side and then the right side. So 0 is here, B0. And then over the left side, and for the right side, macam mana cakap? Sekejap. P0, P1, less than 1 centimeter. So the measurement of the lesion is less than 1 centimeter, hence they put over the right as 1. For the second example, B2/0, because the measurement of the lesion is 2 centimeters, so they put as 2 over the left side. Macam tu. And then this part, lesion measuring 3.5 centimeters, they encoded ENZIAN B3/0. 3 because of the size of the lesion more than 3 centimeters. Okay. For compartment C, this is to assess the ventrodorsal compartment and also the length of lesion in anterior wall of the rectum especially. So they define the lesions located up to 16 centimeters from anal verge will be assigned to compartment C, but any lesion located higher than 16 centimeters will be classified in the ENZIAN compartment F for the lesions. Okay, and then in case of both rectal and sigmoidal deep endometriosis, both anatomical sites C and Fi should be included as well. So here, the transvaginal scan can be done as well as transrectal scan. The classification is according to the ideal group, and the sum of the lesion is measured. So the grading is according to the sum of the lesions. Less than 1 centimeter, 1 to 3 centimeters, and more than 3 centimeters. In addition to this ENZIAN classification, it encodes the adenomyosis and other extragenital deep endometriosis. So this presence of adenomyosis, it is based on surgical findings, which are obvious for adenomyosis, such as appearance, consistency, and size, and if available, histological diagnosis and /or TVS findings. These deep lesions of the urinary bladder, which is annotated as FB bladder, with involvement of muscular layer or ureteric disease, are based on surgical findings that are found obvious for deep endometriosis, and histological diagnosis if available. And in cases of ureteral deep endometriosis, FU correlates to obstruction-related dilatation in funnel shape, either caused by lesion corresponding to deep endometriosis, which is usually parametrial in origin, or deep endometriosis of the urinary bladder with or without hydronephrosis. So actually the initial F is they put as A for adenomyosis, B for bladder, I is for intestinal involvement, and U is for ureter. But it does not limit other lesions, endometrial lesion in the intra-abdomen, such as diaphragm, lung, or nerve. So for this extra organ involvement, it is written in full. So for example, F, diaphragm in bracket. So for this Fi, intestinal involvement, describes the deep endometriosis involving other intestinal structures besides the rectum, lesions cranial to the rectosigmoid junction above 16 centimeters from the anus, which is the upper sigmoid, transverse colon, cecum, appendix, and small bowel. Lesions on other locations such as abdominal wall, diaphragm, lung, nerve are also annotated as F in bracket to be written in full. And instead, previously they mentioned the previous ENZIAN classification, it has a O component for other, but this time they put where it comes this time. So they still others are included to be written in full for other involvement of the endometriotic lesions. Okay, so by TVS, it also can be done. So the urethral diameter equal or more than 6 millimeter is interpreted as congestion sign correlating to ureteric obstruction. TVS diagnosis is be made by visualization of hydroureter or hydronephrosis in the presence of deep endometriosis. But it also mentioned that maybe some early stages of urethral dilatation may not be accompanied by hydronephrosis as well. And this obstruction may also occur due to deep endometriosis of non-parametrial origin, infiltrating the upper pelvic side wall. So here is the challenge for the coding of ENZIAN classification. It is a very comprehensive, but it also can be described by annotating ENZIAN in bracket, which is assessment during the time. So ENZIAN U, it is assessment by ultrasound, M by MRI, and S assessment by surgery. Okay, this is for the beginning part. And then the total encoding should be this way. So ENZIAN P1 O0/2 B1/2 C2 FU in bracket R and FI appendix. So here is the description. So this one, the example is P1. So there is a superficial endometriosis on the peritoneum measuring less than 3 centimeters. Then O0/2, it means there is ovarian endometriosis over the right ovary measuring 4 centimeters. For T, they did not mention the T because there is no additions on the tubo-ovarian unit. Hence, it is T0/0. So it was not encoded in this. As well as the compartment A, here is supposedly there is a compartment here before B, but there is no lesion in the A compartment. So A is 0 as well. For B, compartment B, there is a deep endometriosis at the left uterosacral ligament less than 1 centimeter, which is B1/2, because over the right uterosacral ligament there is deep endometriosis 1 to 3 centimeters. And then C2 is deep endometriosis in the rectum measuring 2 centimeters and also accompanied by hydroureter of the right. So FU in bracket R for right side, and also endometriosis in the appendix F1, F intestinal, which is appendix. So it looks a bit complicated, but it's very comprehensive. This is same like just now, but it is further it is diagnosed by in surgery lah. So as they put here as in surgically assessed, P1 there is peritoneal lesions less than 3 centimeters. O1/0 there is involvement of the left ovary, which is endometrioma, but right ovary no pathology. And then T3 minus, it means there is tube not pattern. Here is where the extra criteria is mentioned. And right aneurysm, no additions but tube pattern, so they put S+. So B2 is the uterosacral ligament involvement with size of lesion 1 to 3 centimeters, and the right side is 0. It means no pathology noted. And here they also put an example in compartment C where they put X because the rectum is not accessible. and F for further endometriotic lesions in the diaphragm. Okay. And also, they also mentioned, although this is diagnosed during surgery, the surgical coding can also include ultrasound findings as well. So ENZIAN as surgical. So this is all noted during surgery. And then compartment 1, they put a small letter U to denote that it is noted during ultrasound findings, but it was not represented by surgery, as well as this part. FA, adenomyosis, which is noted during ultrasound. So actually, this ENZIAN classification, it provides a classification that is anatomically logical and should be easy to use. And then there is a need for further studies to provide the proof of applicability, reproducibility, and accuracy. And thirdly, the correlation between preoperative and surgical staging on the basis of ENZIAN scheme allows for consistent and clear classification of endometriosis, especially deep endometriosis, and also secondary additions to it. And fourthly, endometriosis can be mapped with one single classification system by pre-invasive, which is bioscan, TBS, and MRI, and also invasive method during the surgery. So this is used as a common language for describing endometriosis. Finally, I would like to, okay, I just put this one. As we usually use this revised ASRM for classification of endometriosis. I just put this one because we wanted to see the advantage of revised ASRM and ENZIAN classification, because in summary, ENZIAN classification is more regarded as a very complex classification and poorly understood generally as compared to revised ASRM classification. So in this journal by Dihas et al. In 2013, they mentioned that the advantage of rASRM is well known and most widely used, and also it is more simple, less complicated to the ENZIAN. But ENZIAN has the benefit that it involves the all retroperitoneal structures and also can give a relative precise morphological description. And also the description for deep infiltrating endometriosis is well described as compared to the rASRM. And also for the disadvantage, revised ASRM has more disadvantage because actually they mentioned the severity grade 1, 2, 3, and 4 is not really understandable, and as it does not provide any more information about the morphological involvement of the endometriosis, and it is limited reproducibility. It does not include the retroperitoneal structures and deep infiltrating endometriosis, and also it does not correlate between the extent of endometriosis and pain, and as well as sterility. As compared to the ENZIAN, it does mention regarding this pain, extent of endometriosis and sterility,